Good morning, good afternoon rather. So in starting the research for this topic, I just want to let you all know there's a wealth of information out there that relates specific conditioning program and exercise, therapeutic exercises to specific sports or cater to specific injuries. And in these exercise programs reduce or improve self-reported functional measures, reduce pain, improve strength, neuromuscular control. And a lot of this evidence is what injury prevention programs are based. And when you go to Stop Sports Injuries website, for example, which is a greater collaboration among doctors, therapists, and trainers in the field of sports medicine, you will find plenty of injury prevention training programs out there. When it comes to the big meta-analytical data that actually take these programs, institute it over a larger population, and truly report a reduction in injury incidence, the data gets much smaller. So for the purpose of this talk, we're going to talk about two specific injuries or two specific patient populations that are near and dear to me, which is non-contact ACL injury prevention and overhead athlete injury prevention. So before you can develop any type of injury prevention program, you have to identify the risk factors. And back in the late 90s, the epidemic of non-contact ACL injury became an epidemic, and therefore all sorts of studies started. And what we found were that, as you can see, the girls squatting with the knee falling in, running with the knee falling in, is that a lot of these girls who suffer from a non-contact ACL injury demonstrate core weakness, excessive genu-valgum at the knee related to hip and foot weakness. And those excessive forces with jumping, cutting, and landing is what predispose them to non-contact ACL injuries. So let's get into the studies. One of the first injury prevention programs out there to prevent ACL injury was the one out of Santa Monica with Mandelbaum creating the Santa Monica PEP program. And it was established back in about 1999-2000. In 2005, they published this evidence that showed instituting this program, both in preseason and in season for female soccer players, reduced the incidence of ACL injury compared to age-matched controls who did not undergo a proper training program. And more recently, in 2015, was one of these meta-analytical studies that evaluated obviously a ton of the evidence out there. And in this meta-analysis, they found that most programs, and some of them were well-defined, like the Santa Monica PEP program or the FIFA 11 Plus program, were shown to reduce an incidence of injury. Some programs are more proprietary. Often they're studied, maybe you have an institution that the therapists and the doctors get together, they create a program. It's been shown to reduce injury. And this study was a really great meta-analysis showing that these injury prevention programs do work for non-contact ACL injury. The PEP program being one of them, and the FIFA 11 Plus program also being one of them. Dr. Noyce out of Cincinnati, his institution created the Sports Metrics program for knee ligament injury prevention. And this study back in 2012 showed that only 2 programs were effective in truly reducing the rate of injuries in non-contact ACLs, and that were the PEP program, which we've shown already works, and then the Sports Metrics program, which is obviously his program, but other studies have reported that the Sports Metrics program out of Cincinnati also has reduced the risk of non-contact ACL. So these are quick little blurbs you can find online. The Sports Metrics program out of Cincinnati is the one on the left. The Santa Monica PEP program is the one on the right. Both programs have been instituted both for preseason and in-season warm-ups. It does include strengthening, stretching, plyometric agility drills. It definitely requires a lot of education and training among trainers, coaches, and parents, including the athletes themselves. Another study I wanted to report more recently in 2016, a study by FIFA of the FIFA 11 Plus program, so a little bit of bias, but it was shown to reduce incidence of non-contact ACL injury in female soccer players. And obviously these came right off of Google, these little images, so you can find this information online and start instituting it with coaches and trainers alike. And in conclusion, for injury prevention programs specific to the non-contact ACL, what we know from the evidence now is that it has to be a program that's catered not just in season but also preseason. It's focused a lot on education, the athletes themselves watching each other, giving each other feedback, the coaches, the trainers, even the parents, education about proper landing, proper cutting technique, Strengthening with an emphasis on the hips, the hamstrings, the glutes, the core, plyometric training and neuromuscular reeducation, agility drills, balance exercises. These are all tenets of any valid, reliable injury prevention program for ACL. And I just put neck strengthening down on the bottom because I'm not going to speak about injury prevention for concussion. That is in its infancy as far as evidence goes for that. However, there is some early data that shows, especially in female soccer players, that neck strengthening or neck weakness is somewhat linked to sustaining concussion. So when I educate my soccer players and their parents, I definitely add some neck exercises just in case. It can't hurt. So when it comes to rotator cuff or shoulder injury prevention and overhead athlete injury prevention, we're not quite as advanced in the data as ACL injury prevention. I think that the data is rich as far as establishing proper risk factors and then therefore the strengthening programs to address these risk factors. And we'll talk about that. But there's not as much of that larger analysis that proves that these injury prevention programs are truly reducing the rate and incidence of injury. The risk factors, however, are GERD, which is defined as a total shoulder motion loss of greater than or equal to 5 degrees. That's a picture there.
What's GERD?
It's glenohumeral internal rotation deficit. I'm sorry, I don't know who said that. But it's described as a total shoulder motion loss of more than 5 degrees. So your typical overhead athlete, pitchers specifically, and the rest of us have a certain amount of motion, maybe 180 degrees of motion, that's normal. But pitchers and overhead athletes have kind of a posterior shift of their motion. So they still have 180 degrees, but as you can see from the second picture, they have a whole lot more posterior rotation than they do anterior rotation. But if you compare their dominant side of the overhead athlete to the non-dominant side, what you'll find is the total shoulder motion should be the same. And if you have a loss on the injured arm or the throwing arm, pitching arm, then that's of greater than 5 degrees, that's GERD, that's total shoulder motion loss, a risk factor for sustaining shoulder injury in overhead athletes. Rotator cuff weakness is another one. Scapular dyskinesia, so the movement of the scapula in an improper way is another one. Posterior capsule and cuff tightness, and then also hip core strength or weakness and inflexibility are tied towards the increased incidence of injury in overhead athletes. So we know this knowledge has been established for 15 plus years, and out of this knowledge now there's an advent of more programs to address these risk factors, and probably the most popular program known to us is the Throwers 10. And this was established with Dr. Andrews and Kevin Wilk out of Birmingham, one of the most well-known centers for treating overhead athletes. The Throwers 10 on the left there is 15 plus years old, and it's definitely gotten rehabbed and trying to get more modernized. On the right is a clip of Kevin Wilk, who's a physical therapist down in Birmingham. The Advanced Throwers 10, which has not been as well studied, but that's on YouTube. You can Google it, and it basically takes your basic shoulder and rotator cuff and forearm exercises that the Throwers 10 developed and adds leg and core instability and strengthening as well. So as far as the data, we really don't have these great meta-analytical studies that show across a large population that say, if you do this program, you will for sure have a reduced rate of injury in your shoulder and or elbow. But I did find some scholarly articles, and one of them there is the first out in Europe with handball, the British Journal of Sports Medicine, clearly a reduced risk of injury in handball programs, instituting a preseason and in-season training program that focused on rotator cuff, periscapular strengthening, core, balance, hip strengthening and stretching. Another study there, the effects of a dryland strengthening training in elite swimmers, or in adolescent swimmers rather. This is typical of the studies you'll find for overhead athlete injury prevention. They institute a program, they have improved strength, reduced risk of pain or reported pain, improvements in reported function, but not necessarily a nice large study across several, hundreds, thousands of participants to prove that this program reduced the risk of injury. Another study out in 2012, again, a scapular muscle training program for overhead athletes, decreased pain, improved function, improved neuromuscular recruitment patterns that are shown to reduce scapular dyskinesia. That's where a lot of the studies are in the shoulder and overhead athletes. We know these exercises probably work, but we don't have that long 10-year-old study, for example, that has taken a large population and proven that it's worked like we do for the ACL. And along those lines, really in its infancy, much like the study of injury prevention for concussion is the study of injury prevention for the UCL, which is the elbow and the ligament, or the ligament and the elbow, sorry, that is associated with pain and disability among pitchers. And that is a whole nother topic of discussion. But if you go to ONSF.org, I've got to do a little bit of blurb here. Obviously, you're here because you're aware of ONSF. If you go to our website, we have printed, I've spent a lot of time taking pictures and establishing with my colleagues injury prevention programs that are sports specific, that are injury specific. And these are training programs, but specific to reducing the risk of injury in little leaguers' elbows and shoulders. We have to talk about pitch counts. We have to talk about when they can throw off-speed pitches, how much they should be exposed to that. Again, this is in its infancy as far as studying the reduction of injury in little leaguers. But a lot of what we do know as far as the attempt to reduce this pain and injury is published on the ONSF.org. And just in conclusion, when it comes to rotator cuff and elbow injury prevention for overhead athletes, we definitely need more research. So if you're here and you're a budding scientist and you want to put a study together, email me because I would love to study this further. Rotator cuff and periscapular strengthening is important. It's a tenet of any good injury prevention program. Establishing total motion, strength, balance, coordination, core strength, forearm strengthening, that's all important when it comes to the attempt to reduce pain and injury in an overhead athlete. And thank you. That's